paramedics, the nurse can expect compensation. No compensation in any form. And the nurse offers to help but cannot insist on helping. All right, so again, this is a good example of the nurse, of the Good Samaritan Act. All right, which of the following actions could result in malpractice? Select all that apply. Learns about a new piece of equipment, forgets to complete the assessment of a client, does not follow up on client's complaints, charts clients' drug allergies, questions physicians about an order they need.
People are putting 2 and 3.
Good. So that would be it, 2 and 3. I see the numbers coming through. Great. All right, this is a long one to read, but I'll read it. All right, which of the following situations is most clearly a violation of the underlying principles associated with professional nursing ethics? The hospital policy permits use of an internal fetal monitoring during labor. However, there is literature to both support and refute the value of this practice. I do love that internal fetal monitoring business. Did I tell you I'm going to be a grandmother any day? Any day. I mean, my phone could ring right now and I could be a grandmother. Okay, everybody calm down. This is my first. All right. When asked about the purpose of a medication, a nurse colleague responds, "Oh, I never looked them up. I just give what is prescribed." The nurse on the unit agreed to sponsor a fundraising event to support a labor strike proposed by fellow nurses at another facility. Or a nurse reports that he didn't quite tell the doctor the truth when he was asked if he was following a therapeutic diet at home. All right, so you all are rolling in with 2, and that's really good. So again, we have to look up medications. If we don't know what the meds are, we have to look them up. Okay? There's nothing wrong with looking up medications. It's only wrong if you don't. Following a motor vehicle crash, the parents refused to permit withdrawal of life support from the child with no apparent brain function. Although the nurse believes the child should be allowed to die and organ donation considered, the nurse supports their decision. Which moral principle provides the basis for the nurse's action? Respect for autonomy, non-maleficence, beneficence, or justice? Good. All right, so everybody's picking autonomy. Excellent. And that's a tough one, but keep in mind, people have autonomy. After recovering from her hip replacement, an elderly client wants to go home. The family wants the client to go to a nursing home. If the nurse were acting as a client advocate, the nurse would perform which of the following actions? Inform the family that the client has a right to decide on her own. Well, we know she has the right to decide. I mean, everybody has autonomy, correct? But is that what you're going to do? Are you going to ask the primary care provider to discharge the client to home because that's what the patient wants? Are you going to suggest the client hire a lawyer to protect her rights? Okay. Or are you going to help the client and family communicate their views to each other? Okay, so that would be the best thing. Everybody seems to be picking it, is to help the client and the family communicate their views and come to a decision. All right, so it's important that we have collaboration. We don't want to pit one side against the other. And we certainly don't want to have them hiring a lawyer. All right, values, moral frameworks, and code of ethics influence the professional nurse's moral decisions in which of the following ways? The nurse will provide direct client care that is consistent with the nurse's personal values. Number 2, the nurse will seek to ensure that the client's values and the nurse's are the same. Well, that never happens. And number 3, the choice of moral framework determines what the client's outcome will be. Or number 4, the nurse is bound to act according to the nurse's code of ethics, even if the nurse's values are different. Great, everybody's rolling in with 4s. All right, and that is correct. All right, so that's a good question. Good examples there. All right, so we need to review moral frameworks. So what moral framework is a nurse operating under if he thinks Surgery will cause him more suffering, and he probably will not survive it anyway, and the family may even feel guilty later. Probably won't survive it. Did I see some fours? There is no four. All right, so most of you are picking consequence-based, and you are correct. So it's all about the consequences. You probably won't survive it anyway, so they're just concerned about the consequence. There's no, so that's a good example of consequence-based or utilitarianism. So you need to know, we're talking consequence, we're talking utilitarianism philosophy, we're talking principle-based, we're talking deontological philosophy.
Miss Morris, what is deontology again?
Right, so deontology, think of deontology, deity, think of principles like the Ten Commandments. Well, the Ten Commandments, you may think of, actually that covers 3 religions, but like thou shalt not kill, that's a deontological principle. Thou shalt not steal. People should be able to have autonomy. So a lot of the moral principles that we should be truthful, those are all considered principle-based, whereas utilitarianism is the greatest good for the most number of people. And that's fine if you're most number of people, but then again, we all have individual rights. So principle-based is more individual rights.
Thank you.
You're welcome. All right, the next question, what moral principle is the nurse operating under if he thinks this violates the principle of autonomy? This man has a right to decide what happens to his body. So again, okay, good, you got it. So that is considered deal. Great. All right, the next one. What moral framework is the nurse operating under if he supports an act that brings the most good and the least harm to the greatest number of people? This act is most fair and often used in funding and healthcare, the most good to the most number of people. Again, that would be good. Utilitarianism or consequence-based. So if you have any questions about either one of these, make sure you review this and know the difference between utilitarianism versus deontological and be able to give examples of each, okay? All right, so I added a little more information as far as do not lie. It's rule-based, right or wrong, moral values, do unto others as you want others to do unto you. That is very much a principle-based or deontological. Oh, that was a question? Oh, it is a question. Oops, I just gave the answer. You guys are quick. All right. Did you find that helpful? Running through utilitarianism versus deontological. All right, so let's run through some of these definitions. The right to make one's own decision, what do we call that? Go ahead and type it in. Good. Duty to do no harm, what do we call that?
Beneficent.
All right, excellent. You guys are typing in, and most of you are spelling it correctly. Good. Is often referred to as fairness or equal treatment. Good. Means to be faithful to agreements and promises. I'll be back with pain medication in 10 minutes, keeping promises. And refers to telling the truth. The last one. Emily, you're a very fast typer. Great. All right, you guys, you seem to know those. Now, I did add a social in front of justice because legally speaking, justice and fairness are not the same thing. We get equal justice under the law. That doesn't necessarily mean equal fairness under the law. But when we're talking social justice, then we're talking fairness or equal treatment. All right, everybody good on that one? Okay. All right, more questions. The ability of the client to make personal decisions, even when those decisions may not be in the client's own best interest. What is that? All right, good. Agreement that the care given is in the best interest of the client, taking positive actions to help others. Okay, good. Coming in a little slower on those answers. Agreement to keep one's promise to the client about care that was offered. All right, some of these concepts, I promise you, you will be tested on them. Fair treatment in matters related to physical and psychosocial care and use of resources. Good. Avoidance of harm or pain as much as possible when giving treatment. Right, good. All right, so you guys, you all seem to have those down pretty well. Again, keep practicing those. Support of the cause of the clients regarding health, safety, and personal rights.
Los VAS. Supporting the cause of the clients regarding health. Sofía, ¿dejaste tu baño Schule? Yeah.
Miss Musil, can you be here? Did we lose Miss Musil?
No.
Maybe I can read it.
Could everyone please check to make sure they're muted, please? Thank
There we
you.
go. All right, so willingness to respect obligations and follow through on promises. What is that? Ability to answer for one's own actions. All right, let me put you the answers in. All right, so make sure you know these as well, okay? I like how Erica gives me head shakes. I feel like she's listening to me. Thank you, Erica. All right, let me move on to the next one. What is the type of law that implements and enforces the Nurse Practice Act? Implements and enforces. Public law, common law, administrative law, or statutory law? Well, I have to say that it's administrative law. So what is the type of law that implements and enforces the Nurse Practice Act? So the administrative law portion is going to be our State Board of Nursing. So remember that we have to have the Florida Board of Nursing to enforce the law. So the Nurse Practice